All right, this is our heart model for Bio 208. We are going to start with looking at the external and internal features of the heart and important vocabulary terms. Let's start with the base, which is the top of the heart where all the major vessels connect. Then we have our inferior border where there's a little bit of a point. That is known as our apex. Moving to the right side, we see our right auricle, and inside would be our right atrium. Blood will come into the right atrium from the superior vena cava and from our inferior vena cava. The right atrium connects to the right ventricle. Then we see on the other side over here would be our left ventricle. And then here is our left auricle and inside our left atrium. The major vessel for the right ventricle is the pulmonary trunk, and then we see our pulmonary arteries bringing blood to our right and left lungs. There's a nice piece of white material shown here at the pulmonary trunk and the aorta. This nice white ligamentum is known as your ligamentum arteriosum. It's a key feature that at one time allowed blood in the fetal heart to move between the vessels. Now it is an anchoring point for the aorta and the pulmonary trunk. Moving to the aorta, we see the ascending aorta, the aortic arch, and then the descending aorta. Coming into the left atrium are our pulmonary veins bringing blood back, that is oxygen-rich, from our left and right lungs. Moving to the aorta, we see the first exit point is our brachiocephalic artery, which will eventually bring blood to the right common carotid and the right subclavian and axillary and arm. The second vessel is our left common carotid artery, and our third would be the subclavian heading towards eventually your left arm. All right, now let's take the top part of the model off so we can look at internal features of our heart. Let's go back to the right side and focus back into the right atrium. Remember, the right atrium is receiving blood from the superior and inferior vena cava. It's also receiving blood from the coronary circuit from the coronary sinus. One of the key features, it's a little white circle in the model, usually shown between the interatrial septum, is the fossa ovalis. The fossa ovalis was at one point a hole that allowed blood in the fetus to move quickly from the right side to the left side. After birth, it closes and becomes a connective tissue type scar that we know as the fossa ovalis. For the right atrium histological layers, we are going to see there is the endocardium and the myocardium. And remember that myocardial layer is very thin, but it will have little push-throughs of muscle, and we will call those push-through areas pectinate muscles. They almost look like little pimples. The outer layer is going to be our epicardium. Remember, the endocardium layer is going to be a continuation of simple squamous epithelium. The connection between the right atria and the right ventricle is going to be our right atrial ventricular valve. That is our tricuspid valve. It's going to have chordinae tendineae, and they are going to connect to papillary muscles. And then the inside of the right ventricle is full of struts and ruts that form that trabecular carniae motif. Remember, one of those important ruts is going to be our moderator band. We see our myocardial layer, our epicardial layer, and we see the connection between the right ventricle and left ventricle is our interventricular septum. As we look at the funneling of blood out of the right ventricle, we're going to come into our conus arteriosum, and then we will see our pulmonary semilunar valve. Moving now to the left side, so we see that we have our left atrium, our bicuspid or mitral valve, our chordinae tendineae, our papillary muscles, Again, that trabecular Carnier motif in the left ventricle. For our histological layers, we have that innermost layer, endocardium, the myocardial, and the epicardium or visceral pericardial membrane. For exiting out of the left ventricle, we will go through the aortic semilunar valve. So those are our key features and landmarks of our heart model that are expected for Bio 208 Lab 1, Chapter 20.